Hello everyone, welcome back to Learn Anesthesia Basics. I'm Dr. Kavyamita, MD in Anesthesiology. Today we will be discussing about wrist block. Wrist block is a distal upper extremity block where we block the median nerve, ulnar nerve and branches of the radial nerves. Now let's see what are the types of surgeries for which we use this block. We use this block for superficial surgeries of hand as supplementation after brachial plexus block. Now we have seen the types of surgeries for which we use this block. Let's see the pharmacological choice. As this block is considered for superficial surgeries, lower concentration of local anesthetics is appropriate. Drugs like 0.75% to 1% mepivacaine or lidocaine, 0.25% bupivacaine, 0.2% ropivacaine is sufficient. Let's see relevant anatomy at the wrist. Ulnar nerve lies lateral to flexor carpi ulnaris and medial to ulnar artery. Median nerve lies between palmaris longus tendon and flexor carpi radialis muscle tendon. Radial nerve at wrist is divided into number of peripheral branches. Now let's see the position of the patient. We ask the patient to rest in supine with the arm is extended at the shoulder and is supported on an arm board. The wrist is flexed over a small support, and the most effective position for the anesthesiologist is for us to stand in the long axis of the arm board so that we can see the patient's face while giving the block. Let's see where do we place the needle for giving this block. As we have already established that we block the median, ulnar and branches of radial nerve, let's see where we need to place the needle in order to block these nerves. For ulnar nerve, we palpate tendon of flexor carpi ulnaris and the ulnar artery immediately proximal to the ulnar styloid process. There we use a small gauge short bevel needle and is inserted perpendicular to the wrist and paresthesia can be elicited. 3 to 5 ml of local anesthetic solution is injected at this site. If no paresthesia is obtained, a similar amount can be injected in a fan-like manner between these two structures with near certainty of the block. For the block of median nerve, on a line between the styloid process of the ulna and prominence of the distal radius, the palmaris longus tendon and the tendon of flexor carpi radialis are identified. These tendons can be accentuated by having the patient to flex the wrist while making a fist. The median nerve lies deep and in between these structures. So a blunt beveled small gauge short needle is inserted between these tendons. If paresthesia is obtained, 3 to 5 ml of local anesthetic is injected and a similar amount of injection injected in a fan-like manner if no paresthesia is obtained. For the block of radial nerve, it requires multiple infiltrations for multiple peripheral branches. So, we ask the patient to extend the thumb so that the extensor pollicis longus tendon can be easily identified. A field block is performed at the subcutaneous level in and around the anatomical snuff box, and this block may require 5 to 6 ml of local anesthetic is used. That's it for today. Thank you for watching. Please like, share and subscribe.